most famous physical therapist on the internet.
Hi folks, I'm Bob Schultz, physical therapist.
Brad Hennick, physical therapist.
Because we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
We're going to show you how to heal tennis elbow with self-massage. So tennis elbow is also known as lateral epicondylitis. Quite a mouthful,
Yeah,
Brad.
tennis elbow's a little easier to say.
Right, so the lateral epicondyle, that's that little bump you got here. You got, if you look on the bottom here, you got the elbow, and then you got two bumps on either side. This is the bump that's on the outside of the arm as your palms facing flat up towards the ceiling.
Sure.
So what you have here is you have a bunch of muscles here that come along here, narrow up to a tendon, and attach to that bone.
Right there.
So if you overuse this muscle, and there's also some restrictions that possibly could cause this that we're going to talk about, you can get increased soreness and actually some micro tears in the tendon or in the muscle itself.
So tiny little tears.
Tiny little tears. So what we're going to show you first is the massage. Then we're going to show you some exercises you can do at the end. And we'll tell you why you want to do those, because they can help prevent it from coming on again or for it continuing to happen.
Right. You
So
have some good prevention.
probably need a pillow again, don't we, Brad?
Yeah, let's do that.
We're going to talk about massage right on the tendon itself. So you'll find it's tender. You've had this, Brad.
Oh, yeah, a number of times.
So here's the bump. Usually it's right off the bump towards the hand, and you'll find the tender spot there, and just lightly go over it to start. I put finger over top of finger. Give me a little
Now,
leverage.
if it's flared up, I know from experience it doesn't take much. It's very tender, and then you don't want to go over it if it really hurts. You're going to go away from it more towards the muscle,
right,
and work away from it, and then you work your way towards it as it improves. That might take a few days.
This is a bad day to be doing this, Brad, with your finger.
Oh, actually, it's kind of healed up. Or I won't take that off. Yeah.
All right. So anyway, what the cue here is really looking for is after 30 seconds, if the pain is getting worse, it's too early for this. You're not allowed to do that yet. So if it is fine after 30 seconds, it gets numb or it's starting to plateau, you can keep doing it. Right. In fact, you could do this for up to 15 minutes, which most of you will not be able to do because it's just too long, but you could do it, spread it throughout the day.
Yep.
Another alternative to this, Brad, would be just doing, this is the Mckenzie Method here. You actually just put pressure on the tendon and go like this, lift the wrist up.
Okay.
And that's just starting to put some stress on that tendon without putting so much that it increases the pain.
So it should feel a little bit better with the pressure on?
It should feel better. It shouldn't make it worse. And it definitely should make it worse.
Sure.
It could be plateaued or the same. But if you're too tender to do massage, start with that first.
Sure, that makes sense.
Go to the massage, and eventually the massage you can do probably every other day for 15 minutes, or like I said, 3 times a day for 5 minutes.
Yep.
Brad, you want to show how to use a massage gun with
Sure. Yeah, so if you happen to have a massage gun, you know, one of these big ones is not going to work.
Yeah, that's too much.
That's way too much. This one might, but a smaller one, this one may.
Yeah, that's a handheld massager.
Or, this size really works well for this particular injury.
That's the Q2.
Yep.
And we actually have a video, and we'll mention this at the end too, how to choose the correct massage gun for your pain, or for pain reduction, or for healing, or for muscle recovery.
Right.
So
with this, you're not going to get and go straight in on it. Now these travel in and out.
Yeah, they percuss.
Yep. Oh, that would really hurt on a flared up. So you're going to actually go down. I would start more in the muscle belly and not straight down in, but at an angle. So we got going across the fibers, which run this way. And then you can work that. And you may find some of these muscles actually get knotted up as a result of this injury. So you want to get those knots out. And, after the longer you do it, you should feel those knots relax and release, we call it. And work your way closer to where the injury is, that tendon. But it shouldn't get to the point where you're feeling ow pain. It should feel like it's feeling good. It's
kind of
relaxed.
a feeling good pain.
Yep.
Yeah. And that's pretty much in all cases here. You're going to want to work on that extensor wad, they call it.
Yeah.
That wad of muscles there.
Yeah.
Because they could be tight, and if they're tight, they're going to pull harder on that tendon.
Yeah.
So
Now, this gun you could use, but boy, I really think this one would be better.
yeah, and even the different heads, I don't think would work on that. I mean,
Yeah.
in that case, it is one of the, you certainly could use it on the muscle belly.
Sure.
This one.
Yeah, right.
But
yeah.
but on the tendon, I think it'd be
yeah,
too much.
not working up there.
So you again, make sure you do the muscle belly. That's going to loosen up the muscle itself, and then if you can, go over to the tendon itself,
Yep.
and that'll start to heal it up, get more blood flow to it, and also break up the scar tissue.
Right. But even without an injury, it just feels good right now, Bob. You can just tell you've relaxed things.
All right, I'm going to show you a couple exercises that you can do now, because for what we're finding is that with a lot of people, they're lacking internal rotation at the shoulder.
Sure.
And so, like if you're playing tennis and you're doing a backhand, and you don't have enough internal rotation, you're going to make up that somehow by working the wrist harder and the extensors harder.
Right, so you're compensating.
You're compensating. So you want to restore that internal rotation. Brad's going to first show it with a strap, and then if you want to show it with the booyah stick too, Brad.
Sure.
So,
So let's say I'm right-handed, so it'd be my right hand more than likely would have that tennis elbow on. I'm not going to play tennis with the my
Left hand,
non-dominant side.
now you can do this with a belt. You can just take the loop of the belt,
Yeah.
or you can take a strap, a stretch-out strap, and see how he's working. That's actually internally rotating that shoulder. And it's always interesting to compare one side to another. Like you may find that your involved side can only go up this high, where his uninvolved side can go up that high. And that's an indicator right there that, yeah, you're lacking internal rotation.
Yeah.
Or you might be lacking on both sides.
So you just go pressure on and pressure off, or just go up and hold it. But you should not be doing this where it creates any sharp pain
Right.
anywhere. It should just feel like a stretch. A little stretch pain is okay.
I would also recommend that if you have osteoporosis or brittle bones, I wouldn't be doing any of these.
Or hypermobile joints.
Or hypermobile joints.
We don't want
right.
to have a dislocation
Right.
accidentally.
So you can, for all of these, I'd put out that warning for all
Right.
these exercises.
Sure. Should we show them
Yeah.
with the stick? This is what I do.
And this is what I did.
Yeah.
Because this made a huge difference for us with Brad and I both had impingement of our shoulder. So the
Palm goes out
Yep.
here.
the
So-
painful arm,
let's keep it the right angle because
Okay.
this would be the painful
Sure.
one.
the painful arm, the palm goes out and low.
Yep. So the back of your hand would be up against your butt, and you got to grab it there.
And the palm on the top is facing the head,
Yep.
or
And-
a head.
And then you just work it
You
up.
can work on internal rotation just like you were with the strap.
So we're using the booyah stick, which we're really well for this, but you don't have to have one. You can use a piece of doweling or a handle from
PVC pipe.
Yep, from a broom.
broomstick.
Yeah, but it needs to be smooth because it
Yeah.
slides on your clothing really well. You don't want to do this on bare skin because it'll stick, and that won't be
Right.
very good. And then we go to the chicken wing.
Yep.
Yep. So on this, I don't go way up. It's already tight. All the tissues are tight.
Sure.
So I keep it down here, and then
he's leveraging it back. That's really cranking on that internal rotation. And
again, no pain though, no sharp pain,
pain.
just a stretch feeling.
I don't know. I think there's a couple reasons why this works so well. I think it also kind of puts the scapula up in the right
Sure.
position, but I don't know.
Yeah. Well,
What do I know? All right.
I think you're right, Bob. Though I just know I've been doing my left one a lot lately, and I neglected my right because I don't have the problem here. And now my left one's so loose,
Sure.
I've got to catch up on my right.
Sure. All right. The other thing is, if you're lacking pronation or supinations, you can check this out real easy too, Brad. You put your elbows into your side, and you might even take a ruler to go across to show, because your hand might go like that, but the wrist doesn't get all the way
Sure.
flat. You want to get them almost flat,
Yeah.
and that'd be both ways, this way and this way. If they aren't and they're lacking, again, your muscles got to make up the difference there, and they're going to be working harder. So it's a really easy stretch to do. First one, all you do is bend your elbow all the way up to flexion, and then you're gonna stretch it into pronation, and you're gonna stretch it into supination. 10 times.
You
each
don't
one.
have to remember what's pronation
Yeah, you
and
don't have to
supination.
just turn it both ways.
Yeah.
turn the faucet on, turn the faucet off, both ways.
So you're not grabbing the skin. You actually want to kind of good grip,
Yeah,
so you're
grabbing
grabbing
the-
the bone.
Yep, and just gently apply the pressure, but over time, hopefully you're going to increase the motion. I'm going to show one more, Brad.
With this?
This is a stool. If I could
Oh
have
yeah,
that.
this one.
Yeah, so this is one. It's actually Mulligan kind of did this. Mckenzie did this. These are therapist terms that people would understand. So you're going to take your hand. You're going to actually point the fingers toward yourself. So you're kind of doing a contortionist here. You take the crook of your elbow, go right below the bump here, and you push it. You're going to actually push this bone out that way, out to the side. 1, 2. You can do it 10 times. 3. Now, believe it or not, that actually, I had a tennis pro that, not tennis pro, golf pro that actually, this took it away for her.
Sure.
She had had it for a long time.
And that shouldn't create pain, right?
No,
It should
no.
just feel
Again,
like
pain-free.
yeah.
So,
Well, your wrists are really.
Yeah.
I can't believe how much you can extend
Can you
your
do
wrists.
that?
Well, no, my wrists are tight. No wonder I can't do push-ups without. I mean,
oh, you're pretty close. Well, yeah, you're not
well,
good.
it's really pulling here though. I'm
Well,
gonna have to work on
You're
it.
gonna start working on it. Use the massage gun.
Yep.
So, all right. Thanks everybody for watching. Let's mention the program though, Brad.
Oh yes.
These videos are part of a series of videos on massage. And if you go to the bobandbrad.com, go to the program section, you'll find the entire program on massage, and it goes over every body part. pretty
Right.
much.
Yep. So you pick out the body part you want to massage. You'll see the title is very clear. Look at that video, get the information, and the big bonus is there's a PDF printout which gives a review of the video, so you can print it out. You don't have to keep going back to the video. And the beauty of it is all for free. We don't ask for email or anything. It just is our gift.